Hi friends, welcome back. Welcome back to the Nurse channel. So I hope you all had a very good exam for the Navodaya Vidyalaya. So after Navodaya Vidyalaya, we have a series of exams to come in a very short time. So we will be having the JIPMER Pondicherry exam, the ESIC examination in which the notification we are expecting on the end of March or in the beginning of April, and the Punjab government medical college hospital examinations. So keeping these exams in view, the Nurse channel would like to introduce before you a new series which we named as the JIPMER series, which will be including some 20 questions with questions and detailed answers, which include some general awareness and GK questions also. So this series which are going to start today will be very much helpful for everyone who will be preparing for these exams what I have mentioned in the beginning. So I request everyone who are watching this video and who have not yet subscribed our channel, kindly subscribe this channel and share this knowledge to your nursing friends. So straight away we will move on to our new series, that is a JIPMER series with 20 question and answers with detailed explanation which includes general awareness and GK. Okay, so let's start. So we'll move on to the first question in our JIPMER series. So first question out of the 20 questions. So the first question is from a GK. It's a GK question, and the question is: National Science Day is celebrated on. So this is based on a date. National Science Day is celebrated on. So what is the answer? The options for you are: the first option is 2nd January, the second option is 18th March, the third option is 28th February, and the final option is 28th May. So among these, which day is celebrated as the National Science Day? So what is the answer? So here the answer is 28th February. Okay, 28th February is considered to be as the National Science Day. So why 28th February is celebrating as National Science Day? Here we have the explanation. So the National Science Day is celebrated in India on 28th February each year to mark the discovery of the Raman effect by Indian physicist Sir C.V. Raman on 28th February 1928. Okay, so for this discovery, Sir C.V. Raman was awarded the Nobel Prize in Physics in 1930. So, in respect of Sir C.V. Raman on the discovery of the Raman effect, 28th February 1928 is considered to be as the Science Day in India. Okay, so that was the first question for you. So the next question. So the next question is related to the immunity. So which among the following is responsible for cell-mediated immunity? So I repeat the question: which among the following is responsible for cell-mediated immunity? So the options are: the first option T lymphocytes, the second option B lymphocytes, the third option plasma cells, and the final option beta cells. So among this, which is responsible for the cell-mediated immunity? So answer. So what is the answer? So here our answer is T lymphocytes. Okay, so T lymphocytes are involved in formation of cellular or cell-mediated immunity, and at the same time B lymphocytes, which are converted into plasma cells, produce the immunoglobulin or antibodies, and which are responsible for the humoral or antibody mediated immunity. Okay, so we have two types of immunities here: the cell mediated immunity and the humoral or antibody related mediated immunity. So the cellular or the cell mediated immunity is by the T lymphocytes, and the B lymphocytes are responsible for the humoral or antibody mediated immunity. Okay, so we will move on to the next question. So this is a GK question. Who is the current Union Minister of Health and Family Welfare? Okay, so who is the current Union Minister for Health and Family Welfare? So the options for you are: option number A, Harsh Vardhan; option number B, Jagat Prakash Nadda; then option number C, Mansukh Mandavia; and the final option, Ghulam Nabi Azad. So among these personalities, who is the current Union Minister of Health and Family Welfare? That is a question for you. So the answer is Mansukh Mandavia. Okay, He is the current Minister for Health and Family Welfare and Chemical and Fertilizers of India. Okay, so Mansukh Lakshman Bhai Mandavia is an Indian politician currently serving as the Minister of Health and Family Welfare and Chemical and Fertilizers of India. Okay, so moving on to the next question. So the fourth question for you is, which among the following is not an antihypertensive? Okay, so the question is, which among the following is not an antihypertensive? So the options for you are, the first option is nifedipine, the second option propranolol, the third option dopamine, and the final option is reserpine. So among these, which is not an antihypertensive? So what is the answer? It's a very simple question. The answer is option number C, dopamine. Okay, so we will see the drugs. The dopamine is used to manage cardiogenic and septic shocks, and in that conditions we can see severe hypotension and not hypertension. So it is not an antihypertensive drug. It is a drug mainly used to manage the septic and cardiogenic shocks. Okay, so the other medicines we will see the options once again. That nifedipine, you know, nifedipine is a calcium channel blocker, propranolol, it's a beta blocker, and reserpine, although reserpine is a tranquilizer drug which is used in the psychiatry, this drug is having effect on lowering blood pressure also. Okay, so all other drugs which we have mentioned in our options are used to manage hypertension, although reserpine is a tranquilizer drug but also used to lower the blood pressure. Okay, so among these options, dopamine is the one drug which is not an antihypertensive, it is used to manage cardiogenic and septic shock, to treat the hypotension. Okay, to increase the BP we are using dopamine. Okay, so moving on to the next question. So the fifth question is, sleeping pulse rate is classically increased in which disease state? Okay, so it's a direct question. Sleeping pulse rate is classically increased in which disease state? And your options are, the first option is hypothyroidism, option B hypoparathyroidism, option C hyperparathyroidism, and option D hyperthyroidism. So among these, which is the answer? Sleeping pulse rate is classically increased. You know that the sleeping pulse rate, usually in other cases pulse rate will come down. Okay, so sleeping pulse rate will be increased in which among these disease condition? That is the question. So what is the answer? So the option is hyperthyroidism, option number D, hyperthyroidism. So we will see the signs and symptoms of hyperthyroidism. So the hyperthyroidism signs and symptoms include, the first one is the goiter and exophthalmos. You know that the exophthalmos is the protruding of the eyeball due to edema behind the eye, and it appears only in the Graves' disease. Okay, so that happens in hyperthyroidism. There will be increased pulse rate, hypertension and palpitation, and the peculiarity of this increased pulse rate is the pulse rate during the sleeping hours, the sleeping time also pulse rate will be high. Okay, so that was the question for you in this. So we will see the other signs and symptoms also, so that we will be knowledgeable regarding the hyperthyroidism features. So there will be heat intolerance, weight loss and overeating, diaphoresis, smooth soft skin and hair, and all these symptoms like these are heat intolerance, weight loss, overeating, diaphoresis and smooth soft skin, these are due to increased DMR. Okay, and there will be diarrhea which may be due to increased peristalsis. In hyperthyroidism there will be increased peristalsis which can manifest as diarrhea, and there will be nervousness, tremors in hands, then agitation, and there will be mood swings, and patient will be restless and anxious. Okay, so these are the general signs and symptoms what we can see in hyperthyroidism. So our question was, the sleeping pulse rate will be increased in which condition? So here the pulse rate will be increased, and in the sleeping state also pulse rate will be high. Okay, so that's the answer for our question. So we will move on to the next question. Now question number 6. Which of the following is completely reabsorbed in the proximal convoluted tubule of nephron? Okay, so this question is related to the anatomy of kidney. So question is, which of the following is completely reabsorbed in the proximal convoluted tubule of nephron? Okay, so what is the answer? So the options are, the first option is sodium, the second option is urea, the third option is glucose, and the final option is water. So among these, which will be completely reabsorbed by the PCT, proximal convoluted tubule? That is a question for you. So what is the answer? So the answer is glucose. Okay, so we will see what is happening in the proximal convoluted tubule. So largest amount of solutes and water will be reabsorbed from the proximal convoluted tubules. Okay, so solutes and water, largest amount of solutes and water will be reabsorbed from the proximal convoluted tubule, and organic solutes like glucose and amino acids are reabsorbed 100% from the PCT. Okay, so all glucose and amino acids will be reabsorbed. That means 100% of glucose and amino acids will be reabsorbed from the proximal convoluted tubule. So here comes our answer. Okay, so we will see the other points also, the water, sodium, potassium, and it will be reabsorbed 85%, and bicarbonate will be reabsorbed 80 to 90% into the proximal convoluted tubule. Okay, so from this you will be getting information regarding the things which all are reabsorbed in the proximal convoluted tubule. So larger amount of solutes and water will be reabsorbed. In that, glucose and amino acids like organic solutes will be absorbed completely 100%, and the water, sodium, potassium will be reabsorbed nearly 85%, and bicarbonate will be reabsorbed 80 to 90% from the proximal convoluted tubule. Okay, so the answer is clear for you now. So moving on to the next question in our JIPMER series, the 7th question. It's a current affairs. It's a question from the current affairs. The question is, an artificial intelligence based chest x-ray technique was recently developed by whom? So this AI technique you can see in the recently launched mobiles and all. So the same artificial intelligence based chest x-ray technique was recently developed by whom? Okay, by which IIT? That is the question, and your options are option number A, IIT Palakkad, option number B, IIT Jodhpur, option number 3, IIT Hyderabad, and final option is IIT Patna. So which IIT developed the artificial intelligence based chest x-ray technique? So that is the question. So what is the answer? So the answer is IIT Jodhpur. Okay, so this IIT Jodhpur has recently developed this artificial intelligence chest x-ray machine, and this chest x-ray technique will be used for COVID-19 screening also. Okay, so just a current affair knowledge for you. So moving on to the next question from our nursing topics itself, which is from the chromosome genetics. So the question is, sex chromosomes are also called as dash. The question is very simple. Sex chromosomes are also called as dash. So the options are option number A, allosomes, option number B, chromosome 18, option number C, autosomes, and the final option, chromosome number 16, chromosome 16. So sex chromosomes are also called as dash. So what is the answer? So the answer is option number A, that is allosomes. Okay, so you know that the sex chromosome, that is a 23rd pair, are also called as allosomes or heterochromosomes or idiochromosomes. Okay, so the 23rd pair of chromosomes are known as the sex chromosomes, otherwise known as allosomes or heterochromosomes. Why heterochromosomes? Because they are having a different genetic constitution in male and female. Okay, it will be different in male and female in their genetic constitution. Okay, and what are autosomes? So we talked about allosomes. Then what is autosome? Autosomes are all the chromosomes that are involved in any other function except for the sex determination. Okay, so out of the 23 pairs, the rest of the 22 pairs of chromosomes are called as the autosomes, and they are not involved in the sex determination. Okay, if the sex determining chromosomes are the 23rd pair, that is known as the allosomes, and the rest of the chromosomes are termed as the autosomes. Okay, so the answer for our question was, so what is the answer for our question? That is allosome. Okay, so moving on to the next question, 9th question. So the question is, which among the following diseases are caused by human papilloma virus? Okay, that is HPV. Which among the following diseases are caused by human papilloma virus? So the options are option number A, herpes simplex, option number B, Warts, option number C, herpes zoster, and the final option, chickenpox. So which among the following diseases are caused by human papilloma virus? So what is the answer? So don't be confused. Herpes simplex is there, herpes zoster is there, chickenpox is there, Warts is there. So what is the answer? So the answer is option number B, Warts. Okay, so we will see each one in brief. So what is a Wart? Warts are the circumscribed cutaneous elevation resulting from hypertrophy of the epidermis. Okay, so wart means it is a circumscribed cutaneous elevation. Okay, and it is resulting from the hypertrophy of the epidermis. Okay, from this question itself, from this explanation, you are getting answer for another question, that it will involve only the epidermis. Okay, there will be hypertrophy of the epidermis in warts. And this genital wart means wart of the genitalia, which is caused by the strains of human papilloma virus, some of which are transmitted by sexual contact. Okay, so the genital warts is caused by strains of human papilloma virus, and these are transmitted by sexual contact also. Okay, so that is the answer of our question. So we will see the other options also. So you know that chickenpox was an option for this question. So chickenpox is a highly contagious disease caused by varicella zoster virus. Okay, it is caused by the VZV virus or the varicella zoster virus, and the other option was the herpes zoster. So you know that herpes zoster, otherwise known as the shingles, is an acute cutaneous viral infection caused by the reactivation of varicella zoster virus. Okay, so the reactivation of varicella zoster virus can cause an acute cutaneous viral infection, which is known as the shingles or the herpes zoster. Okay, so that's all about the question. So the another question is the 10th question, which is from the GK, and the question is, which union ministry launched the Swachhata Startup Challenge? Okay, so the question is, which union ministry launched the Swachhata Startup Challenge? So the options for you are Ministry of Housing and Urban Affairs, Ministry of Rural Development, Ministry of Agriculture, and the final option is Ministry of Home Affairs. So which ministry launched the Swachhata Startup Challenge? That is a question for you. So what is the answer? So the answer is option number A, Ministry of Housing and Urban Affairs. Okay, Ministry of Housing and Urban Affairs. So we will see that the Ministry of Housing and Urban Affairs launched the Swachhata Startup Challenge to nurture the evolving ecosystem of Indian waste management sector on 27th January 2022. Okay, it's a very recent, it's a very recent knowledge. Okay, it is the ministry has launched the Swachhata Startup to nurture the evolving ecosystems of Indian waste management sector. Okay, it was launched on 27th January 2022. Okay, so a recent one. So moving on to the next question from our nursing subject, that is, which are macrophage cells in the central nervous system, or the CNS? Which are macrophage cells in central nervous system? Okay, so like these questions you can expect in any of the exams, because the cells of central nervous system is very, very important. Okay, each cells are very, very important, and some of the other types of questions can be asked from this area. So now our question for you is, which are macrophage cells in the macrophage cells? Okay, so the options are, the first one is microglia, the second one is astrocytes, the third one is neuroglia, and the final option is oligodendroglia. So among the cells, which cells have the macrophage or the phagocytic property? So what is the answer? Microglia, astrocytes, neuroglia, or oligodendroglia? So what is the answer? We will see the answer is microglia. Okay, so cells present between neurons or next to the capillaries which are capable of the phagocytosis are called microglia. Okay, microglia cells, they are present in between the neurons and next to the capillaries which are capable of phagocytosis. Okay, so these microglia cells may function as macrophages when they migrate to damaged CNS tissues. Okay, when they are migrating to the damaged CNS tissues, they will show the function of macrophage. Okay, and the other cell, that is the astrocytes, they are star-shaped glial cells in the central nervous system. Okay, so just a microglia you understood. No, these are the neurons. These are the cells which can be seen between the neurons and next to the capillaries. They have phagocytic properties, and they have macrophage property when they are moving towards the damaged central nervous system tissues. Okay, so one of the option was the astrocytes. So astrocytes are the star-shaped glial cells which can be seen in the central nervous system, and the another one option was the neuroglia. So what is neuroglia? Neuroglia are a diverse class of cells that provide developmental, physiological, and metabolic support for the neurons. Okay, so neuroglia means these are the diverse class of cells that provide developmental, physiological, and metabolic support to the neurons, and they are responsible for maintaining homeostatic control and immune surveillance in the nervous system. Okay, so homeostasis of the nervous system is maintained by the neuroglia. Okay, so the another option was the regarding the oligodendrocytes. So Schwann cell is wrapped around the axons of the nerve cells found in the peripheral nervous system, whereas oligodendrocyte is wrapped around the axons of the nerve cells found in the central nervous system. So this statement also is very important, because this cells, what is wrapped means that is a myelin. Okay, so myelin in the central in the peripheral nervous system and the central nervous system is formed by which cells? So this is also a repeatedly asked question in various central government exams. So Schwann cells are forming the myelin in the peripheral nervous system, and the oligodendrocytes are forming the myelin in the central nervous system. Okay, so from this question you are getting answer for many questions. Okay, so that's all about that question. So our question was microglia, regarding the microglia. Okay, so that is clear now. Now we will move on to the next question, that is a 12th question. It's a very important but very easy question. Breastfeeding must be initiated within dash of normal delivery. So the question is very clear. Breastfeeding must be initiated within dash of normal delivery. So the options are within 1 hour, within 2 hours, within 30 minutes, within 4 hours. So what is the answer? Breastfeeding must be initiated within dash hours of normal delivery. Question also should be very careful. Normal delivery. So the answer is 30 minutes. Okay, so we will see in normal delivery feeding should be started within 30 minutes, and in the cesarean section it should be started within 4 hours. Okay, so 30 minutes and 4 hours. 30 minutes for normal delivery and 4 hours for cesarean section. Okay, clear. So moving on to the 13th question in our JIPMER series, and the question is here. The question is, which of the following viruses are made by the mass production of virulent viruses? So the question is, which of the following viruses are made by the mass production of virulent viruses? Okay, so the options for you are: the first option, live attenuated virus vaccines, then virion subunit vaccines, live recombinant virus vaccines, and the final option, inactivated virus vaccines. So which among these vaccines are produced by the mass production of virulent viruses? Okay, so that's the question. So it's an interesting question. So what is the answer? So here the answer is inactivated virus vaccines. Okay, inactivated virus vaccines. So we will see the explanation for this question. Inactivated virus vaccines are made by the mass production of virulent viruses and then inactivating the infectivity. Okay, so I think it is self-explanatory. So the mass production of virulent viruses will be done and then inactivating their infectivity. Okay, by this way inactivated virus vaccines are produced. So the inactivation is done usually by treatment with a chemical such as formaldehyde. Okay, so the inactivation chemical is the formaldehyde, and it is also known as the killed virus vaccine. Okay, so this is otherwise known as killed virus vaccine. So the answer for our question is inactivated virus vaccine, which is produced by the mass production of virulent viruses, then inactivating them. Okay, so killed vaccine or inactivated virus vaccine. So that is the 13th question. Now we will move on to the 14th question. So it is from the community health medicine, community health nursing. So the question is, the most significant health status indicator of a community is. So the question is, the most significant health status indicator of a community is. So your options are: the first option is life expectancy at birth, the second option is disability prevalence, the third option is resources available, and the final option, psychosocial development of children. So what is the answer? Life expectancy at birth, disability prevalence, resources available, and the final option, psychosocial development of children. So what is the answer? So the answer is life expectancy at birth. Okay, so we know that the life expectancy at birth reflects the overall mortality level of a population. Okay, so this life expectancy, it is reflecting the overall mortality level of a population. Population means it summarizes the mortality pattern that prevails across all age groups. That means from children and adolescents, adults, and the elderly. Okay, so the whole population will be covered in this, and it will reflect the overall mortality level of a of all age groups. Okay, overall mortality level of all age groups. That's why it is a best indicator of the health status of a community. Okay, so life expectancy at birth is the answer for our question. Okay, so that was the 14th question. Now we will move on to the 15th question. So this is from the dependence, that addiction medicine. So the question is, which among the following is the most common symptom of opioid toxicity? Okay, so question is very clear. Which among the following is the most common symptom of opioid toxicity? And the options are: option number A, constricted pupils; option number B, dilated pupils; option number C, dyspnea; and final option, high fever. So which among the following is the most common symptom of opioid toxicity? So what is the answer? So the answer is constricted pupils. Opioid toxicity, most common symptom is constricted pupils. So you know that opioid, that is synthetic narcotics toxicity, is characterized by apathy, hypotension, bradycardia, respiratory suppression, low temperature, and constricted pupil. Okay, that is pinpoint pupil can be seen in opioid toxicity. Okay, so once again I'll repeat, opioids means these are the synthetic narcotics, and its toxicity can result in apathy, then hypotension and bradycardia, respiratory depression or suppression, then hypothermia, and pinpoint pupils or the constricted pupils. So definitely the answer for our question is constricted pupil or pinpoint pupil. Okay, so moving on to the next question from fundamentals of nursing, the 16th question. In an adult, enema tube should be inserted inside the rectum up to. Okay, so question is, in an adult, enema tube should be inserted inside the rectum up to. So up to what level? So the options are: the option number A, 1 to 2 inches; option number B, 5 to 6 inches; option number C, 3 to 4 inches; and the final option, 7 to 8 inches. So here the question is asked is how much the enema tube should be inserted in an adult. Okay, so what is the answer? So the answer is 3 to 4 inch. Okay, that means 7.5 to 10 centimeter. So enema tube should be inserted inside the rectum up to 3 to 4 inches. That is means 7.5 to 10 centimeter in adult, and in children up to 1 to 1.5 inch. That means 2.5 to 3.75 centimeter. Okay, so be clear, don't be confused between centimeter and inches. Here the question is asked in inches, so should be very careful while reading the question. So here in adult we have to insert the rectal tube up to 3 to 4 inch. That means 7.5 to 10 centimeter, and for children it should be 2.5 to 3.75 centimeter or 1 to 1.5 inch. Okay, so that's clear for you now. So now we will move on to another general knowledge question, that is the 17th question. Purple revolution is associated with cultivation of dash. So question is, purple revolution is associated with cultivation of dash. So the options are: option number A, fruits; option number B, aromatic plants; option number C, spices; and final option, cash crops. That means cashew crops. So purple revolution, what is purple revolution? So the answer is aromatic plants. Okay, option number B, purple revolution is associated with the cultivation of aromatic plants, and it is also called as the aroma mission, and was launched by the Union Ministry of Science and Technology through the Council of Scientific and Industrial Research. That means CSIR. Okay, so it is also called as aroma mission, and it was launched by the Ministry of Science and Technology through the Council of Scientific and Industrial Research. Okay, so that was a general knowledge question. So we will move on to the next question, that is the 18th question. Vitamin B3 is otherwise called as. It's a direct easy question from nutrition. Vitamin B3 is otherwise called as. So the options are riboflavin, pantothenic acid, pyridoxine, niacin. So which is the answer? Vitamin B3 is otherwise called as. It's a very simple question. Answer is niacin. Okay, so the other vitamins what we have given in the options we will see. We know that vitamin B2, otherwise known as the riboflavin, vitamin B5, otherwise known as the pantothenic acid, and the vitamin B6, otherwise known as the pyridoxine. Okay, B2 is riboflavin, B5 is pantothenic acid, and B6 is pyridoxine. Okay, so that's all about the 18th question. So now we will move on to the second last question in our JIPMER series part 1. So the 19th question is very important question. Temperature used in the autoclave for effective sterilization is. So here the question is regarding the autoclave temperature for effective sterilization. So temperature used in the autoclave for effective sterilization is. So the options for you are option number A 100 degrees Celsius, option number B 110 degrees Celsius, option number C 121 degrees Celsius, and the final option number D 131 degrees Celsius. So how much is the temperature used in autoclave for effective sterilization? So what is the answer? So the answer is definitely 121 degrees Celsius. Okay, so so we know that the sterilization condition of autoclave are 121 degrees Celsius, otherwise 250 degree Fahrenheit. Okay, 121 degrees Celsius or 250 degree Fahrenheit temperature. Then how much should be the pressure? Pressure should be 15 pound. Okay, the pressure should be 15 pound. And how much will be the holding time? The holding time is 20 to 30 minutes holding time. Okay, so it depends upon the material we are using. Okay, so from this question you are getting answer for 3 questions. So what is the temperature? That was the question, and the temperature is 121 degrees Celsius or 250 degree Fahrenheit. Then how much is the pressure in the autoclave? It is 15 pounds. And what is the holding time? That is 20 to 30 minutes depending upon the material used. Okay, so that was a easy direct question and was an important question. Now we will move on to the last question of our JIPMER series part 1. So the last question for you is blueprint plan of a research study is known as. So it's from the research. So blueprint plan of a research study is known as dash. Okay, blueprint plan. So your options are research design, sampling, hypothesis, assumption. Okay, so what is the answer? Blueprint plan of a research study. Research design, sampling, hypothesis, assumption. So the answer is, what is the answer? So the answer is research design. Okay, so what is a research design? Research design refers to the framework or a blueprint of market research methods and techniques that are chosen by a researcher, which includes descriptive, correlational, then causal comparative or quasi-experimental and experimental research. Okay, so we heard about these types of the research. Okay, so these are the methods or the framework or the blueprint methods or the techniques that a researcher must be using for his or her research. Okay, so that is termed as a research design, and we have several types of research designs like descriptive research, correlational research, then causal comparative or the quasi-experimental research, and quasi-experimental and experimental research. Okay, so we will see the other options also. So the first option was a sample. So what is a sample? Sample is a subset of individuals from a larger population. Okay, it is a subset of population in which the researcher want to study. Okay, so that subset of individual from a larger population is termed as a sample. Okay, then what is a hypothesis? So hypothesis is a specific testable prediction about what you expect to happen in a study. Okay, so hypothesis is a testable prediction, so that will be tested, and it will be specific, and it will be about the expectations of what will happen in the study. Okay, that is named as hypothesis. Okay, and the final option was assumption. So what is an assumption? Assumption is an unexamined belief. Okay, so hypothesis, it will be testable, but assumption means it is an unexamined belief, what we think without realizing we think it. Okay, for a simple example, we are going for a party thinking that definitely dinner will be served. Okay, so that is an assumption. So dinner will be served is an assumption. Okay, so that's the difference between hypothesis and assumption. So from this question you are getting information regarding 4 points from the research. That is a research study, sorry, research design, that is a framework, then a sample, that is a subset of population, then hypothesis is a specific testable prediction, and an assumption is an unexamined belief. Okay, so that's all about the today's discussion. So Today we have seen around 20 questions from different parts of our different areas of the nursing subjects, which will be helpful for your upcoming exams. So try to stay in tune, and we will be coming up with the part 2 of the same series very shortly. So till that time, continue watching, continue learning. So stay tuned. See you soon with another video. So thank you once again.